Hi, I'm Dr. Mario Vega, board certified OBGYN and fertility expert. If you're trying to conceive and want to know more about male infertility, watch this video. We will be discussing topics such as what to do when a semen analysis is abnormal, male age and fertility, and varicocele. So first, let's start with the basics. When we're evaluating a couple with infertility, a semen analysis is a fast tool that can help us know whether male infertility can be the cause. We actually ask for it in our clinic even before the first appointment. It is a simple test where a man ejaculates into a cup, then we take the sample, we examine it under a microscope to see the movement, the quantity, and the morphology or shape of the sperm. If any of these are abnormal, then the first step would be to repeat the semen analysis, as a man's sperm can vary each ejaculation. Couples where the man has consistently abnormal semen analysis are the ones that will have difficulty achieving a pregnancy. Now, you may ask yourselves, how many semen analyses should a man have to determine whether he has male infertility or if it's just a bad sample? There's no perfect answer for that, but most fertility experts would agree that 2 samples taken a month apart is a good indicator of semen quality. Actually, a study from 2018 looking at differences between first and second semen analysis in the same patient revealed that about half of the second samples confirmed the initial findings. 25% had a normal semen analysis, but 40% of initially abnormal samples had a different abnormality in the second sample. So what should a couple do after consistently having abnormal semen analysis? The first step is to try to identify factors as to why this is happening and treat any correctable factors. Some of the problems that may cause this are hormone problems such as thyroid problems or elevated prolactin or low testosterone. There's something else called varicocele, which is an enlargement of the veins that are in the scrotum that can also be a cause. It is important to know that many times treating these problems may not be enough to achieve a significant improvement in the semen analysis, and treatments such as IUI or IVF with ICSI may be necessary. So let's move on to the next male topic, age and fertility. We have known for a long time that a woman's age affects fertility, but what about male age? There are many studies that have looked at male age and infertility, including male age and IVF success. Overall, there was no difference in IVF success between younger males and older males, when other factors such as a woman's age were not taken into account. Now that we have covered some interesting topics, let's talk about a condition that many men have. It's called varicocele. Varicocele is the presence of dilated or enlarged veins in the scrotum. The big question is, does it affect infertility? The answer is sometimes. Now, let me explain that. If you take men with normal fertility, you will find that around 20% have varicocele. But if you take men in couples with infertility, around 40% were found to have varicocele. There is not a clear understanding as to how varicocele affects sperm, but it is thought that the increased temperature of the blood raises the temperature of the testicles, damaging sperm or affecting production of new healthy sperm. So how do you know if you or your partner has varicocele? The most obvious cases can be seen or felt like a bag of worms in a physical exam in the scrotum, especially when you're exerting intra-abdominal pressure, such as doing abs. The American Urological Association states that only varicoceles that can be felt have been associated with infertility, but not everyone in my field agrees with that. So what do? You have a varicocele and have been diagnosed with infertility. You might not have to do anything, but if your doctor thinks you do, there is a number of treatments that can be done. For example, embolization of the veins, or tying up or removing the veins. All of those are surgical options that can be performed. Another possibility is to make better use of the sperm that is available through an IUI or intrauterine insemination, or to do IVF. So if you do have varicocele, do not panic, as you may not need any surgery to correct it or to improve your chances of getting pregnant. It is really a case-by-case issue. If you are trying to achieve a pregnancy and we use anything like IVF or IUI, usually they exert really good pregnancy success numbers. So that's it for today. If you have enjoyed this video, click subscribe. If you have any questions, feel free to comment and I'll get back to you in the next video. Until next time.